Board-certified urologist Dr. Jennifer Grunenfelder is here to tell us more about this breakthrough treatment. Thanks for joining us. They're on your turf now.
Most people associate Botox with my specialty, treating wrinkles to stop the muscles contracting, which in turn is going to help your wrinkles soften them, get rid of them. But another application.
That's a great side effect for your wrinkles, but so much more exciting to use it for a problem that affects 15 million Americans. I mean, more people have an overactive bladder than the whole of New York City, if you think about it. And you've all seen the ads. You know what those pills do. But patients don't like the pills. I mean, think about it. She's 25. I'm going to put her on a pill every day for the rest of her life, or I'm going to do a 5-minute office procedure once a year. And the other problem with those pills is that they have a lot of side effects. You get dry mouth, dry eyes, constipation, and so often patients will come in and they say, well, yeah, I guess the pills helped. I'm down to 1 pad a day, but I'm so miserable with the side effects that I'll go back to 3 pads a day and not be so constipated all the time. Botox is great because you can just treat them and then they're done. The rest of their body isn't seeing the medicine. You inject it directly in the bladder. You don't have all of those systemic side effects that come with taking the pill.
As a gynecologist, the women usually start in my office complaining about the symptoms, or they don't complain at all. And it's really important that women talk to their doctors about this because a lot of times we have to elicit from them what's going on with their bladder because they're very embarrassed about this. And there are very few treatments, but you have to determine exactly what type of incontinence it is. Is it overactive bladder or urge incontinence? Is it stress incontinence? And that's why then often we'll send our patients to a urologist or a gynecologic urologist to determine, because you need to fit the right diagnosis with the right treatment. And this is the right treatment for that, and it's a breakthrough treatment for women with this type of problem.
There you go. As she says, we put Raquel through some testing. You don't want to just walk in and say, hey, I need Botox for my bladder, because there are many different things that can cause incontinence. But for the right patient, it makes such a difference. I had a young woman like Raquel, while we were involved in the clinical trials, who came into my office and said to me, do you know what I did today? And I said, no. And she said, I bought underwear. I've been wearing Depends for 5 years.
It can change a woman's life. I mean, because this can be debilitating, because it can keep you from doing the things that you love to do as far as sports or activities, or just keep you from being able to sleep at night.
And this may benefit men as well, correct? If
absolutely.
If they're having bladder issues related to their prostate, you inject the bladder and the prostate as well sometimes, right?
There are clinical trials right now for Botox in the prostate, but for men who've had problems with the prostate, they can develop an overactive bladder because the bladder is working so hard to get past that prostate, and Botox could help those patients too.
Well, I think this is a great breakthrough for everybody with problems with
God bless Botox.
Yes.
How is Raquel doing
Raquel is doing great.
She
actually felt the efficacy within the first few days, and she says the contractions have completely gone away.
Thanks so much, Dr. Grunenfelder.